Hi. As a registered nurse with some experience in cardiac care, I understand the challenges and uncertainties you may face after undergoing cardiac surgery. This video is designed to be a companion to patients and also their family on the road to recovery, offering guidance, support, and hopefully some practical advice to help you navigate this journey with confidence. During this video, we'll go over on what to expect during your recovery, tips for managing your health post-surgery, and strategies for adapting to a new lifestyle. My goal is to empower you with knowledge to ensure smooth and successful recovery. I have seen firsthand the resilience and strength of patients, and I'm confident that with this right support and information, you will emerge from this experience stronger than ever. Remember, also, you're not alone on this journey. Your healthcare team, family, and friends are here to support you every step of the way. Thank you so much for your time, and let's begin. So, first of all, I just want to go over some general type of teaching. So, immediately, if you feel chest pain identical to what you experienced prior to surgery, which is that intense heaviness in your chest, uh, or other signs that were there if you had like a previous MI or heart attack, or if you have fainting or loss of consciousness or a collapse, severe difficulty breathing, like you can't breathe at all, or severe fast fluttering heartbeat that makes you feel dizzy or unwell, palpitations, meaning you feel your heart racing and you feel dizzy because of that, and it doesn't settle within 5 minutes, or a large amount of bright red blood in your urine, your stool, or any part of active bleeding that you're actively bleeding, I want you to immediately call 911 if those are your symptoms. And I also want to go over some other symptoms. If you have symptoms such as increase in weight gain, such as 2 to 3 pounds over 2 days, or increase in fever, such as greater than 38.5 degrees Celsius or 101 degrees Fahrenheit. If there's shortness of breath that does not improve even after you stop your activity or when you rest, new or worsening cough, or changes to your skin around your incisions or cuts, such as new redness, warmth, swelling, or new fluid or drainage, especially if it's foul smelling in nature, and increase in pain. Or if there's extreme fatigue that is new or not improving, a faster fluttering heartbeat that doesn't go away within in 3 hours, or uh, again, like if there are some small traces of blood, uh, or like oozing, if you have any kind of questions or concerns, sometimes you can go and call the surgeon's office number, or even if they provide you with any kind of community resources, so specific to your location, that you can go and contact, like a 24/7 helpline, especially for the first month after surgery. You can go and contact that number, such as the surgeon's office number or that community number, if you have these symptoms. As for activity, so I want you to remember that there's no pushing, no pulling, no lifting more than 5 pounds with one hand, no more than 10 pounds with both hands for up to 6 weeks after surgery, okay? And I know you're not going to be doing this, but no driving for 6 weeks to 3 months after surgery as well. I want you to get driven by somebody. And one thing is, or to use like some sort of uh, bus or something like that. And I want you to go and sit in the back seat of the car, or if you are getting driven by somebody, and there should be a chest pillow between you and the seat belt, so that way you can splint your chest, so then there's not that much pressure on your chest. I also want you to walk for about 30 to 40 minutes a day. So this one will encourage you to start building that strength again. And it is normal to feel some shortness of breath after surgery. One thing is that it should go away after stopping and resting. And one thing I want you to do if you feel shortness of breath is to take a deep breath in with your nose as though you're smelling in flowers, and then to make an O with your mouth as though you're blowing out a candle. I want you to do that 5 times every 30 minutes as you're feeling shortness of breath. That's a special way of breathing. It's called pursed lip breathing. It's going to help create positive pressure between you and your lungs. It's going to help you absorb more oxygen. And your shortness of breath should go away after that. Some physios might even advise for you to, if it's too difficult for you to breathe in through your nose, if you want, you can go and breathe in through your mouth because it is a bigger opening. But one thing is, after a while, try to go and again breathe through nose. And if you do feel that shortness of breath doesn't go away with stopping and resting, uh, and if you feel too much shortness of breath, again, you can let that surgeon's office number know, or that community resource that you have, if you have a number, to go and call them if that is the case. So as for diet, there's just some core tenets that I just want you to know. So one thing is follow a well-balanced diet that's low in salt, low in saturated fats, and high in fiber. So what does that mean? Basically, I want you to use a pinch of salt where you use a lot of salt. I want you to avoid fried foods. I want you to avoid processed foods, things that are like TV dinners. Try to avoid that. And one thing also is I want you to eat green leafy vegetables, or colorful vegetables. The colorful vegetables and fruits, they are high in antioxidants that will also help your immune system a little bit too. And you are in a little bit of a fluid restriction, especially undergoing heart surgery. Because of that, you're a little bit swollen. We want you to be at a fluid restriction, so then those previous fluids can come out. And so you're in a fluid restriction of 1.5 to 2 liters per day. And one thing I also want you to do is I want you to start reading food labels and see if it's high in sodium or if there's high in saturated fats. So I want you to choose unsaturated fat instead of saturated fat, such as fish, flax, and sesame seeds, some nuts and sunflower oil, olive oil, canola oil, corn oil, and soybean oil. You can also limit trans fats or hydrogenated fat found in processed and pre-made foods, such as some margarines, crackers, french fries, potato chips, and commercial baked goods like cookies and pies. You can choose medium to low-fat versions of milk and milk products. You can choose leaner cuts of meat with fat trimmed, whereas before maybe if you used a large steak, instead you can use lean cuts of meat. And I want you to include a variety of meats and meat alternatives instead. Try to limit your amount of red meat as well. You can also choose more whole grains and limit grains that are made from white flour. So I want you to use like whole wheat or like brown bread or brown rice, whereas you'd use like like white bread or white rice instead. Try to use whole grain versions. And I want you to do that like at least once per week. I want you to eat lots of dark green, yellow, orange, and red fruits and vegetables as well to increase your antioxidant intake. I want you to increase your fiber intake slowly and with plenty of water, as long as it's within that fluid limit. And sources of fiber include bran, oatmeal, bran buds with psyllium fiber, legumes, barley, apples, citrus fruits, and strawberries. Heart-friendly cooking methods include baking, grilling, roasting, stir-frying, steaming, boiling, and/or barbecuing. Limit deep frying and deep-fried foods, though. And also, if you drink a lot of caffeine, coffees, and teas, I want you to limit caffeinated beverages to 2 cups per day, where 1 cup is 250 ml. So, don't be fooled. The ones that you're probably getting in hospital are actually decaf, and this caffeinated version of cups, that is actually decaf as well. So don't consume caffeinated beverages unless you get withdrawal from it, and that I want you to follow up with the cardiologist, with the cardiac surgeon, or the family physician if you can go and consume it. But I want you to have 2 cups of decaf to your coffee a day. So not caffeinated, but decaf, where 1 cup is 250 ml. And I want you to slowly lower caffeinated beverages to avoid withdrawal symptoms like severe headaches. And yeah, so again, you could limit salt intake by using a pinch of salt, whereas you'd use a lot of salt. Choose unsalted or lower sodium versions of food when possible. Obviously, you need some salt to have like for sodium levels, but in this case, just try to avoid using a pinch instead, whereas you use a lot. You can also use herbs and spices, lemon juice, vinegar, and Tabasco sauce to flavor food. Also, be aware of the different type of sauces. Sometimes some sauces that you buy are high in sodium or high in unhealthy substances. So make sure you take a look at those. If you want a specific meal plan, however, that you want me to recommend, uh, the meal plan I recommend to patients usually is something called the DASH diet. It's called DASH. It's specifically made for people with cardiac complications such as hypertension, or in your case, heart surgery or coronary artery disease. Uh, so one thing is, you can go and search up online for different specific meal plans according to your culture that are under the DASH diet. So again, it's spelled DASH, and you can search it up on Google. So I want you to go and shower just like how you did before surgery. So if that was daily, I want you to take daily showers just like how you did before, uh, but with some changes now. And I want you to avoid baths for at least 6 weeks. I want you to shower with warm water using mild, unscented soap. And this is very important, but I want you to pat and wash those incisions with like a towel or something. Do not scrub or rub your incisions, okay? So just light dabs across it. And I want you to pat them dry as well, so avoid rubbing. Do not use any creams, oils, perfumes, powders, or lotions uh, on these incisions for up to 6 weeks to 3 months' time after surgery. So basically that the incisions, they will close up. It will usually take about 6 weeks to 3 months time for it to completely close. So after that, you can go and put creams on your incisions, but until they close, do not put anything. uh, Obviously you can put creams and oils and stuff like that on places that are not your incisions. So if you need deodorant and stuff like that, you can obviously use that as long as it's not near the incisions, right? So wherever those incisions are, do not use creams, oils, ointments, perfumes, or anything of that nature. Only unscented soap and water. If it is itchy, apply ice to numb the area. Do not scratch. Leave incisions open to air when it's exposed to the natural bacteria in the air. It's actually the best way for it to go and heal. So one thing is they might have used dissolving stitches during your surgery or other types of stitches. Um, so one thing is when it's open to air, it will go and heal better. Watch for signs as well of infection. You know your body better than anybody else. So I want you to keep a watch on your body, because now that you're not in the hospital, you'll be the first person to know if there's anything wrong, right? And even if you are in a hospital, you know your body better than anybody else, right? So one thing is I want you to take a watch on those surgical incisions, see if there's any new redness, swelling, drainage, or foul-smelling drainage or anything that's coming from that area of the incision. I want you to watch if the incision is warm to touch. If the edges start to open up, sometimes they can open up, and if there's increased pain or fever, such as again temperature of 38 degrees Celsius or higher, and if the edges start to open up, I want you to keep a watch on that as well. If these symptoms happen, I want you to again call that community service number that they gave you, or the surgeon's office number, if that is the case. As for swelling, so swelling is normal, especially it's very common after heart surgery. The reason is because they pumped you in with a lot of fluids during surgery, and so because of that, you're going to be swollen. The fluids, it can come out through a couple of ways. One way is through peeing, other way is through coughing, the other way is through drainage. So drainage, well, you most likely had chest tubes in you. That's one way that the drainage came out. Another way is that the drainage can come from your surgical incisions. So you might actually leak some fluid out from those incisions. And it's common, and I don't want you to be scared. It's not just blood. It's a combination of those fluids they pumped you in with and blood. So hopefully that makes you feel a little bit better. No, but actually, it's common and it's nothing to be really so scared about as we're continuously monitoring you. So with that, so one thing is that if the edema or that swelling basically gets worse, sometimes you can follow up with the physicians, and the physicians will go and try to give you something to help you get those fluids out through another way, probably through peeing, by giving you something like Lasix, also known as furosemide. It's medication to help you pee out those fluids. Uh, One thing I want you to do is to follow up with that drinking fluid guideline you were given after surgery. So usually they put you on a fluid restriction. So again, that 1.5 to 2 liters of fluids. Try not to drink more than that. So that's because we want those fluids that are already in you to come out, right? And one thing you can also do is you can elevate your legs. Swelling in your legs will gradually improve once the other veins in your leg also start to remove fluid as well. So one way that it'll do that uh, is by going on walks. And by walking, uh, it'll help for those fluids to go and move. One thing you might notice is after you started moving a little bit more, you might have noticed that you got this cough. So the coughing, it's going to be there. It's also normal, but it's because you're starting to move more. And that food, so that's a way that the lungs or well, that sputum is going to come out, and hopefully that will help you with your breathing as well. So once those fluids come out, it'll help you with breathing as well. So it's very common to get some fluid even in the lungs as well. It's called pleural effusion. That is one way that fluid also can get accumulated. uh, One thing is by like moving, going on walks, by consistently following with these medications, hopefully you can get those fluids removed. And I want you to go and check your weight daily in the morning. uh, so I want you to go and weigh yourself every morning. So you're probably weighed in the hospital as well, but I want you to do it now every time that you wake up. In the morning, not obviously as early in the morning. I'm pretty sure you didn't get enough sleep in the hospital, but I want you to weigh yourself when you can every time you wake up, okay? Hopefully so make sure you try to do it every day, okay? And you should eventually see a loss in weight, and eventually it'll stabilize the weight that you were prior to surgery. We do not want to see an increase in weight to just 2 to 3 pounds again in 2 days. So if that is the case, you can again call that community number or the surgeon's office number. So we want you to eventually continuously go down in weight and eventually stabilize at the weight that you were prior to surgery. So I just wanted to go over like some general like next steps, like kind of what to expect after. So this is like different for every single like hospital and facility usually. So I just want to go over some general possible things that you might expect to go and see. So usually they'll give you a prescription to go to a pharmacy that you usually go to, and to go and pick up those medications. Uh, Depends. Sometimes they might, if they have a pharmacy downstairs, they might go and do that, or they might fax it over to a different pharmacy for you to go and pick up the medications usually that you take in the afternoon, evening, and in the morning from then on. Uh, and so usually they'll give you that, or they'll fax it over, or they'll find one way to give you some medications uh, to help you in the meantime. So that's usually what they do, or for you to go and pick it up yourself immediately on the way home as well. So that can also be an option. So that's it today, usually, like on the day of discharge. And in 1 week's time, usually you go and see a family physician. So uh, one thing is the family physician, what they might go and do, the one that you usually go to, they might go and check your blood pressure, your vital signs, things like that, your oxygen level, your temperature. They might also do some blood work on you, and they're also going to go and see what kind of medications that you are on now, and they might go and change it up depending on how you're doing. So they might go and continue or change, uh, to like diuretic, your therapy for diuresis, basically for you to pee out those fluids. If they notice that your swelling is getting better, they might go and discontinue that. However, if they feel as though that you might need more, they might go and change some of those medications that you currently have. They might also go and restart any blood pressure medication you were previously on. They'll do things like that, basically. They'll go and change up medications, and they'll see how you're doing depending on how you are presenting now, 1 week after surgery. So that's common. That's usually in 1 week time. One thing even prior to 1 week time that they might do, if you have repeat tests that you might go and do, they might go and ask you to come back again within like the hospital or somewhere. As an outpatient, they might go and do a test, whether it's a chest x-ray or any kind of other test or appointment that you might need, uh, whether it's a chest x-ray or something like that, just to go and see how your breathing is. And if there's any fluid still in there, if there's any kind of concerns, they might go and follow up with that. That's even prior to 1 week time. But yeah, in 1 week's time, usually family physician. 2 months time, usually cardiologist. So the cardiologist, what they're going to go and do is they're going to go and do an echocardiogram. What that is, it's an ultrasound of the heart. They just want to see how your heart is doing after surgery. So depending on that, again, the family physician, the cardiologist, the cardiac surgeon will go and make a plan depending on how your heart is doing, how it's healing. So that's usually in 2 months' time. The echocardiogram is usually done, the ultrasound of the heart, just to see how your heart is doing. 1 month's time after that, the cardiac surgeon will be contacted, and they'll work with the cardiologist to see, depending on the results of your echocardiogram, depending on how your heart is doing, they'll work with the cardiologist to make the next steps from there, and what your plan might go and be. So this is usually what happens. So in on the day of, usually pharmacy, uh, the 1 week's time family physician, 2 months time cardiologist, and 3 months time cardiac surgeon. That's usually what it is. However, for each patient, it's different. If they have other types of complications, they might get other types of physicians, an endocrinologist if they're like for their diabetes, or like if they have a diabetic clinic, or if they have like other kinds of conditions, they might have other appointments or other needs that they need to go and do. But this is typically usually the next steps after surgery, especially for coronary artery bypass. Yeah, I just want to say thank you so much for watching my video, and I hope this helped a little bit. And if you need anything at all, don't be afraid to go and contact the healthcare team. Make sure that you let them know any kind of questions or concerns, okay? So make sure that you go and let a physician or healthcare worker know about any kind of concerns. And I just want to say thank you again for watching, and please like and subscribe if you can. Yeah, let me know if you want me to continue making these kinds of videos. But yeah, hope you have a great day, and wish you all the best of health. Thank you so much. Have a great day and a great life.